Dr. Hub. Today we'll look at the common sites. The common sites in case of the ear tumors. So first we'll be looking at the sebaceous cyst. The sebaceous cyst, the common site is the post-auricular sulcus. Next, we move on to the dermoid cyst. Dermoid cyst is most common site is the post-auricular area. Then comes the keloid. The keloid, if you see, it is the most common site is the pinna, and it is around the piercing site. It is around the piercing site. Next is we look at the cutaneous horn. So what happens in case of the cutaneous horn? The cutaneous horn is present in the helix, and the acoustic neuroma. The acoustic neuroma, it is present in the vestibular nerve. Vestibular nerve. Next is the squamous cell carcinoma. So the squamous cell carcinoma, it is the most common site is the helix. Then is the basal cell carcinoma. Basal cell carcinoma, the common site is the helix as well as the tragus. Then we move on to the malignant melanoma. So this is the malignant melanoma, and here the common site is, it can be present anywhere. It may be present anywhere. So this was all about the common sites of ear tumors. We saw some, name a few: sebaceous cyst, keloid, squamous cell carcinoma, and seeing the common site. To learn and grow daily like this, please do subscribe.